We'll go to a minute. Do you want to do a microphone check, Dale?
Can you hear me okay?
Yes, sir.
All right. Hello, how's everybody? I hope everybody has something fun planned for Thanksgiving.
With other people?
I didn't say that. With appropriate social distancing and caution.
Yes, I've got my silo party all planned.
Yeah.
All right, the recorder's on. It's 1:30. I think we're ready.
Okay. Well, thank you everybody for joining. We have 30 in attendance, and I'll defer to Julia and Shelley to do the roll call. But a couple of housekeeping, if we could. Everybody's pretty familiar with the Google platform that we're using. If you hover at the bottom, you'll be able to check your mic. And if you're not speaking, try to keep the mute on. As you know, background noise sometimes interrupts us. If you're calling in, it's that *6 that you have to hit to turn your sound on and off. Please know, everybody, that this is being recorded and it will be posted in the minutes. So if you put anything in the chat or verbalize anything, that will be captured through the recording. And I think that is the extent of my housekeeping comments. So I'll turn it over to Shelley and Julia to do a roll call.
Thanks, Dale. I will just do a quick roll call. So we have Don Darling on the line.
Yep, I'm here.
Awesome. Dr. Lord, we know you're here. RJ?
I am here. Thank you.
Jordana? Okay. Tony Karazina?
I'm here. Thank you.
Mickey Kovac? Heather Miller? Jacqueline Evans?
Julia, it's Heather. I'm here. I'm sorry.
Oh, okay, no problem. Thank you. Tony Huma? Ann Stafford? Chris Ramos?
I'm here.
Debbie Johnston?
Here.
And then Julie Augenstein? Okay, looks like we are right at our 7.
Okay, we have quorum. Thank you for that. You know, in the past, we used to do roundtable introductions, but there's 35 of us now, which I am ecstatic about. The bigger the group, the more the brainstorming, the more the ideas we get input. So probably would be too cumbersome to go through everybody unless Julie or Shelley disagree. But as if there's anyone new to the group who wants to give a shout out and make a, I don't want to put anybody at ease, but if anyone wants to give a shout out and they're new to the group, please do so. I'll give a couple seconds.
May I introduce myself?
Absolutely, Tony. In fact, I have you in my list to welcome you aboard. So you can have the honors.
So my name's Tony Carazino. I'm a chief flight paramedic with Guardian Air Transport. I've been with Guardian Air for approaching 7 years and I've been a paramedic since 1998. So I'm very excited to bring some of my relevant experience to the board here and representing names. So thank you.
Welcome to the group, Tony. Looking forward to seeing you guys in early March for the Pediatric Symposium. Anybody else want to give a shout out?
Looks like Teresa Ennert does.
Oh, great.
She's raised her hand.
Please. Mic is yours. Do not want to put anybody on the spot.
Okay, well, I don't know about that raising hand little
Okay.
icon.
All right, well, good to have you with us at the meeting. Just as a reminder, for the standing members of the committee, if you miss more than 2 consecutive meetings, the Bureau will reach to you and confirm that you want to be able to stay on the meeting. And this is that attendance list. Okay, thank you, Shelley. So I do have an update regarding our Safe Sleep project that we had started, about a year ago. Through a series of small group work sessions, we created a toolkit, which was essentially a presentation with supportive materials and even case vignettes. And the concept was to allow an educational module to be available to pre-hospital providers, EMS agencies across the state, in a CE compatible manner for agencies to be able to tap into. The premise behind that was the most common preventable death in infants is unsafe sleeping environments. So if we are more effective at educating, we would like to think we'd have an impact. The clinic and hospital environments have been really good at educating on this matter, but few states have gone to the extent of encouraging at that education in the pre-hospital environment. So the process and the strategy was to make a toolkit, have it be available for EMS agencies to use as it fit into their workflow in the field, and then be able to see if we have an impact on infant deaths. The Education Committee met on that just earlier this morning and approved it. So a big shout out to the PACES group and everybody who had worked on that. Great job. Education Committee has now approved it. I think, Shelley, Julia, correct me if I'm wrong, but it will then go to the EMS Council for a vote, and if approved by the council, can be placed on the Department of Health website as a downloadable tool for any agency who would like to use it. So I think it's a great product that our committee's been able to put together. Julia, Shelley, any comments on that?
Nope, that's correct. Thanks.
And Julia, hats off to you. I'd like to congratulate you in front of everybody. She really was the one that kind of coordinated everybody's thought processes and put all these things together. So she put a lot of work into it. So thank you, Julia.
Thanks, Dale.
Our other breakout sessions was that of working towards efforts, whether we could create materials and or disseminate education in regards to special healthcare needs. And that would be for pre-hospital application first responders in our state. That I think was probably more affected by the COVID interruptions because we weren't as far into the project. But I'm wondering if I can get more of an update on that.
Yes, RJ, I think is prepared to give an update.
Oh, great. Thank you, RJ.
Absolutely. Thank you again for the opportunity to be a part of the group. We met in July, late July, by video conference, obviously, and really it was our first meeting. Very, very good, productive meeting. Lots of brainstorming. We had about 7 or 8 very good members on board to do brainstorming. And we talked about everything from simulation and looking at what other states are doing and tools that they have and what can we all bring together. Lots of great ideas that people brought up. Ultimately, we kind of boiled it down to say, we need to, start with good first steps that we can all work with and that seem to achieve some objectives to get EMS education out for special needs children. Dr. Bradley especially was very good and wanting to work with airway, breathing, and circulation as it relates to special needs kids, especially if they have airway appliances, trachs, and that kind of thing. And then the second focus that we really want to work on is communication between the EMS pre-hospital member and especially parents and direct in-home caregivers, as well as those caregivers, although it may not exist much now, but at schools or daycares where special needs kids may be when they have a medical event. So I think kind of the idea is what can we put together that will work with ABCs, the primary threats to life that we may encounter, and then communication skills, because obviously parents are the very best resources for special needs kids as to what their syndromes are, what their physical and psychological and emotional needs are, and then what can we do to work with and better interact and engage with them. We have not had any subsequent meetings, so hopefully sometime, perhaps even at the end of today, we can find a time when we can get together and with our COVID world, see what we can start working on.
I think this might be a good time, or at least by email, Julia, to start setting up a date and time for the work group to meet, at least in the interim before, so we have some work to bring back at our next PACES meeting. The scheduling we can do online, but I will say to everybody who's on the call that these work groups are open groups. RJ had mentioned we had 7 or 8 members in the last meeting, but we invite everybody who is listening to be able to join us to be able to work on the project. Special healthcare needs is broad, so we can branch sections off and go into smaller groups to be able to work on those. Similarly, RJ in the last meeting had, I think, alluded on the fact that a lot of work on this has been done. So in the absence of wanting to recreate the wheel, compiling existing material and then being able to apply it to our own communities, I think is a good strategy going forward. And that might be an issue of just compiling it into another toolkit. The benefit of a toolkit being that it's one place where anybody interested can go and get all that material that's collated for you and endorsed material that has been reviewed and has good quality. So RJ, am I speaking appropriately on all that?
Yes, sir, you are, absolutely. And given I haven't spent as much time with it since that meeting, but one of the options, and I will do it, is reach out to my former state where I was very much part of the MSC and see what they have that they are willing to share with us that I can bring. We had a fair amount of materials. I'm sure they'd be happy to share it with us and proceed that way. And if anybody has any additional resources from previous experience, other states, other organizations, agreed, please reach out to them and let's not spend time reinventing the wheel if it already exists. I agree, sir.
Great, thank you. So those are our 2 active working topics. So if no one else has any more comments, I'll move to the next section. Any comments from the group on either of those items, safe sleep or special health care?
This is Julia. Let me just make one point of clarification that I just had to check on myself. But the safe sleep education module won't have to get approved by EMS Council. We're free to post that on the website, but we will probably present it to them just for awareness. And so we can promote it that way. Just to clarify.
Wonderful. Wonderful. Well, when we are able to actively post it, Julia, maybe you can share the link to the whole group so we can spread it around and make sure everybody's aware of the resources available.
Absolutely.
Great.
Okay. I guess we can start with the Bureau report. Before I get started, I would like to introduce our new Bureau Chief, Rachel Garcia, who comes to replace Terry, who left, as you all might be aware. But Rachel, would you like to say a few words?
Good afternoon, Julia and Dr. Woolridge. I hope you can hear me. Thank you so much for letting me say, thank you for letting me join this meeting this afternoon. I'm looking forward to participating in subcommittee meetings moving forward. I have been with Arizona Department of Health Services since 2019. I joined the team as a Deputy Bureau Chief working in public health emergency preparedness. I want to thank you guys for your patience as I transition into this new role. I'm still playing a role in our Emergency Operations Center supporting our COVID-19 response. A little bit of a briefing about our COVID-19 response is that right now we are getting prepared for COVID-19 vaccine to become available. We expect to receive our first vaccine in towards the end of the year in December. We do not expect that the emergency use authorization will initially include pediatrics. Children have not been included in many of the clinical trials to date for the first two presentations that are being tested. I have some more information I can share on COVID-19 if there are questions, but at this point, I will turn it back over to Julia. I look forward to participating in future meetings. Thank you.
Thanks, Rachel. Okay, just a couple of announcements. As you see on the agenda, the dates for this one are not correct. It's supposed to be January to March 2021. But if you recall, earlier this year, the National EMS Data Analysis Resource Center conducted a survey among EMS agencies across the country. So it's asking about 2 EMSC performance measures, the Pediatric Emergency Care Coordinator and practicing with pediatric equipment. And so we're doing that again. So that will be starting in January. So the survey will run from January to March. I would appreciate any and all promotion of this just out in the field as you are able. But I will be sending out some information about that soon. Secondly, the National Pediatric Readiness Assessment, which is the pediatric readiness assessment of hospitals, will be taking place this upcoming summer. It was originally scheduled for this year, but due to COVID had to be pushed back. So that will be another thing that we are planning for next year. And then I think at our last meeting, Sri presented the pediatric EMS data report. Well, an updated version since then is posted on the website. So if you're interested in looking at that, you can go to the Bureau's webpage under, I think it's Data and Quality Assurance, and view that if you'd like to. Yeah, there you go. Thanks, Shelley.
You want me to go there?
You can just look at it, yeah.
I usually hit divisions and then I go down to EMS. And then data and QA. On the homepage? No.
Quality assurance reports.
Okay.
Yes, and then annual reports. So I guess it is quite a couple of steps to get there. 2020 Pediatric EMS Annual Report. The pediatric one. But yeah, so that's how you find that if you're interested in viewing that updated report.
Thank you for leading me there.
And then lastly, just another quick kind of update. So we received a grant from the Governor's Office of Youth, Faith and Family to create training related to adverse childhood experiences, or ACEs. So this is going to be a more interactive online training module that's in the process of being created. So that will be an exciting product once it's completed. So I'll be sure to share that with you as it is finished. That's all I have. Back to you, Dale.
All right. So our next item is to discuss the PACES. Oh, there we go. Okay, so we're going to be discussing the PACES draft meeting minutes. Can I have a motion to discuss and approve from the group? Anybody?
Yes, sir. I do, sir. Thank you.
Okay, thank you, RJ. RJ motions. Can I have a second?
Jackie seconds.
All right. Thank you, Jackie, very much. So Shelley is showing us the draft minutes from the July meeting. And then we'll just scroll through this. Holler out if you wanted to scroll back upward. Are there any amendments to these minutes that people would like to suggest? Hearing none, I would request a vote to approve. Those in favor say yes or aye, and no or nay. Do you approve?
Oh, I'm sorry.
Aye.
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 Do we have anybody who does not approve? Okay, the ayes have it, and the draft minutes from July are approved. Okay. All right, thank you, Shelley. So Shelley's now showing us the safe sleep side. Say that fast. The safe sleeping slide set for our toolkit. And we have 37 slides, so I'll have her scroll through it. Many of you are aware of the slides. The Education Committee approved this a couple hours ago. And I'm after we quickly go through it, and again, shout out if you would like Shelley to text to scroll back upward. You can go a little faster, Shelley, if you want. After reviewing this, we're going to ask for a vote for PACES to approve it in its final form. Okay. So the slide set starts with a lot of data regarding the Arizona Child Fatality Review Report and really substantiates the fact that unsafe sleep environments are almost universally preventable and are our #1 cause of preventable deaths in kids. And then we talk about what's the appropriate way to place a child and what not to do, and what defines an unsafe sleep environment. So after defining the unsafe component, then we talk about the safest way of doing it. Major organizations throughout the country, American Academy of Pediatrics particularly, shares all the concepts that that we're placing in this slide set. So once again, we're not reinventing the wheel. We're assembling it for our Arizona partners, all of our pre-hospital partners. I really like the work that was done on this because we have such a large Native population in Arizona, and cradle boards are a CDC-approved sleeping environment for kids. Very safe manner in which the child is immobilized, but still interactive with a clear airway, as you can see through the picture. So, okay. And then what's the role of the EMS provider? What can we do in the home? How can we educate? Respecting cultural practices, but encouraging the safe sleep that we do as far as the education component is concerned. And Julia, don't make me do all the talking if you want to have some comments about things. We always, part of the CE component is to get feedback from the learner, and we do a pre-test and post-test follow-up. But for impact-related issues, we want to do a follow-up survey, so we encourage that also. But you just saw the comments on the pre- and post-test. Again, it's a complete module. not shown here, but happy to email out copies to people, are our case vignettes. You know, so if we are ever in a way in which we could have a large classroom setting, you know, you can go through the slide set and then do small group breakouts and go through each vignette. And you actually practice that verbal approach of how you would communicate safe sleeping to a guardian, you know, in the home. So
And
I think we
now
have, yeah. Oh yeah, go ahead, Shelley.
the toolkit now.
yeah. Oh, okay. You do have it. Good. Great.
Maybe 17 pages.
And a big shout out to the Arizona chapter of the AAP. I don't know if Anne's on the phone, but she offered us a lot of resources because, as I mentioned, the American Academy of Pediatrics has been doing this in the clinic environment for a number of years. So these are scenarios that we put together. You know, things you can say, tips, key points to make, but all kind of applied to what you may have, you may see in the field, or why you may be called to a scene. Frequently asked questions to kind of prompt and or prepare you for questions that may be happening when you do and or have an opportunity to intervene, and then resources that you can offer to the family members, whether it be you know, cribs or educational components, and then these are pre-test and post-test. Course evaluation forms. This is a handout flyer. Yeah, that's the course evaluation form. Again, it's a complete kit on if you want to do CE for your own agency, and then a handout flyer.
And that
Great.
was the last.
Any questions from the group about the toolkit? Okay, so I would ask for a final vote to take this forward and to ultimately, as Julie had said, post it on the Department of Health website as an educational tool for our partners.
You might need a motion to approve first.
Oh, I'm sorry. Thank you. Can I have a motion from the group to approve approve this toolkit?
This is Debbie. I move it.
Thank you, Debbie. Second?
This is Jordana.
Second.
All right, Jana and Dawn, thank you both very much. Okay. And then make sure I'm correct here. Do I call for the vote now? I'm still getting used to the system.
Yes.
Okay. All right.
There's no voiced amendments to the motion.
Okay. Are there any amendments to the toolkit that anyone like to put forward? Okay. In the absence of amendments, I'm going to ask the group to vote to approve the toolkit in its present form. Yes versus no, A versus nay. Do you, for those of you who approve, say aye.
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 Great. And are there anybody who disapprove, who would say nay? Okay, the ayes have it. The Safe Sleep Toolkit has been approved in its current form. Great, thank you, and my apologies for being rusty on the parliamentary process.
We got guardrails.
Just keep me on track. Okay, I guess that steps me down now to 5D would be to discuss future projects.
I'm gonna do another point of order.
Pardon me?
I'm just gonna call out, we need to do 5C.
Oh, yes. I'm sorry, you said 5C.
Correct, 5C.
Okay. Yes, I missed that one. So in the Education Committee, it was discussed to allow a PACES member to be a standing member on the Education Committee. I think it's a great idea to have a pediatric influence and presence on the Education Committee, and I thank Dr. Rice for considering that. But we need amongst the group to have a volunteer who would be willing to be a standing member on the Education Committee. What we're looking for is someone who's going to be actively involved in their projects, in their breakout meetings, actively participate in the meetings when they do have them. But the Education Committee does do a fair amount of work groups, and if they're pediatric involved, then we definitely want a member who would be active in that role. Do we have anybody in the group who would be willing to be our standing member for the Education Committee?
This is Chris Ramos. I can do it if no one else wants to do it.
Gail, this is Gail. Can you hear me okay?
Yes, ma'am.
All right, excellent. And just wanted to make sure that this group knows that the Education Committee meeting is the same day as PACES, so it's the same 3 meetings a year. We do have occasional work groups that meet between those meetings, but it is the 10:30 time slot, same day as PACES. So we have those meetings grouped together. So we really appreciate this group being willing to hopefully support someone on the Education Committee.
Thank you, Gail. And repeating what Gail had said, that even though those quarterly meetings on the same day, the work group meetings are in the interim. So those would be in addition to the standing quarterly. Okay, do I have anybody else? We want to make this fair, and if there's more than one person to do kind of a runoff or something, do we have anybody other than Chris Ramos who would be willing to do that?
This is Randy, RJ. I think Chris is an absolute excellent person to be involved with this. Should support or somebody needed to be stand-in, I'd be happy to be in the backup role if needed.
Okay, maybe Shelley can check to see if that's a potential. I don't know if they do stand-ins, but thank you for that.
Fine. Understood. Thank you.
So Shelley, keep me correct here. Do we need to vote for Chris to take that position?
Yeah, generally you want your group to have consensus around who you're sending.
So I would move, actually, who would move to nominate Chris Ramos to be our standing member for the Education Committee? And I have all right, so we got a first for Tony. Do we have someone who will second that?
I'll second that.
Thank you, RJ.
Yep.
Okay. So I would like to now vote to identify Chris Ramos and assign him to our representative for the Education Committee. Those who approve say aye. Those who don't say nay. First, the ayes. If you approve, say aye now.
Aye.
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 Okay. And for anybody who disapproves, who would say nay? Okay, the ayes have it. And Chris, congratulations and thank you very much. If there's anything we can do in the wings while you're in a work group, any resource materials or any opinions or advice that the rest of the committee can offer, I think it's fair game to bounce things back to the PACES committee. And Gail, correct me if I'm wrong on that. But as a group, I think we can offer help.
Yes, that's correct. Thank you. So that'll be wonderful to have a representative that then can give a more formal report back and forth between the two committees.
Great.
Thanks, everybody.
Great. Thank you, Chris. So Now I can go to the next item. Discuss potential projects going forward. So I think a great task completed with the Safe Sleep project, but I think we need to remain an active committee. So beyond the special healthcare need projects, we're interested in identifying some other materials or projects that the committee could be working on. And that's where it's kind of a brainstorming as a group. Does anyone have any suggestions or ideas in which, in where PACES can now turn its efforts towards? Anything specific to your region, whether it be educational? Well, Julia, would while people are pondering this, I think maybe we can, over the next couple of weeks, continue to ask people to brainstorm, and then maybe email ideas back to Julia. If there's something that we would need to get an early start on, we can always discuss it by emails. But if not, there's ideas coming forward, then we can always bring them up at the next PACES meeting for a group approval to move forward on it.
Absolutely. If anybody thinks of anything, please definitely don't be shy. If you have an idea that you would like to see the group kind of tackle, please bring it forward. But yeah, anytime you can email me and we can kind of see what we can do moving forward to work on that project.
May I ask, is there a catalog of previous projects that we have worked on? Being new to the group, I don't want to make a suggestion for something that was just completed and not being aware of it.
That is a great question. I have not been, honestly, with PACES for too long, a little bit over a year. And so I don't know, Dale, are there any projects that you think would be kind of things that you already accomplished that wouldn't work moving forward? I think we probably would be open to most ideas at this point.
No, yeah, and to be honest with you, not in the recent past. There was a period of time in which the PACES meeting became less active as the grant cycle went forward. And then last year, there was kind of a restructuring of PACES and a recreation of it under Julia's coordination. So it kind of put us at a new start, so to speak. In the distant past, we did do care modules for the school environment, and that resulted in a fairly lengthy PDF document that summarized multiple medical conditions and kind of care algorithms in the school setting that was promoted for school nursing. That was one, but that was again very distant. So we essentially did a reboot a year ago, and anything new going forward wouldn't be hampered by any past projects.
Thank you, Dr. Woolridge.
You bet. Okay. Okay.
So I've done a little bit of research on some things that other states have done. If you want me to kind of show a couple of ideas.
That'd be
really
great.
Quickly. I mean, okay. So this is something that I haven't seen that we have something similar to this. Let's see. That I've seen another state do.
Do you want me to stop sharing my screen?
Yes. So some states have things kind of like this, like pediatric scenario guidebooks. That could be something interesting to work on, I think. So this is Kansas, just kind of random, but could be an option. Let me try. So I guess kind of like some of the other materials we already have for the state, but maybe make it something more pediatric specific. Let's see. That's just what I had pulled up right now. This might be a pretty fast project, but if we wanted to do some sort of pediatric assessment card like this, that was specific to the state that we wanted to kind of include our own information on. I will just say that this website for EMSC has a ton of different kind of materials on it for state program managers for sure, but also for the EMS community as a whole. So if there is something on there that you see as a resource that you think could be kind of developed to work specifically in Arizona, that could be a starting point. So those are just all like ideas of some things that other states have done that I think of off the top of my head. But
yeah, I'm more familiar with the Southeastern region EMS Council. And I'm privy to the fact that we have, and I think all the regions do it, they have guidelines and protocols in regards to treatment scenarios for different medical conditions. We do advise the EMS Council, but I think it could be very reasonable to approach all the EMS regions and ask them if they need a second set of eyes on their guidelines, that we could have input in on that. Creating our own guidelines might be redundant from the regions, because I think the regions develop their own. And Gail, if you can correct me or elaborate on that, please feel free to.
Sure, I can at least speak for the Central Region. The Central Region's guidelines are modeled off the state TTTG, so the state treatment guidelines, which were approved by PMD and MDC. These have been pretty well vetted with input from Dr. Augenstein and Dr. Gross as well prior to Dr. Augenstein. So at least for the Central Region, I know that those are pretty up to date. I can't speak to the full state on the process.
Yeah, I personally have had a fair amount of input in the Southern region, so I think the same applies here, but can't speak it for Northern or Western.
So you're saying that
Heather from Western, and we follow, just like Dr. Bradley said, the state guidelines. So we're current with what's going on with the state. And we also had implemented a hand-heavy implementation in our region. So most of us are pretty current with what's going on in the P's for our region.
Okay.
Yeah, that's good feedback. We don't want to be repetitive if there's already existing things out there. I'm just kind of trying to see what other states have and see if there's anything that we would want to work on. But that's good feedback. Thank you.
There's a comment in the chat window about asking about child abuse, risk factors, recognition, and intervention.
Well, for full disclosure, I'm the medical director of the Advocacy Center in Southern Arizona, so that's my other hat. So if the person who made that chat comment, are you suggesting we develop an education module, or maybe handouts or flyers that we can make available to the EMS agencies? Tell me more what your thought was, if you'd be willing.
Hi, it's Carrie. I'm one of the trauma NPs.
It's barely can hear.
Okay. Is that better?
A little bit. Try one more time.
God, I never get told I'm too quiet. Is that better?
Maybe it's my mic. Can everybody hear okay?
It's very soft on our end too.
Yeah, it is.
Try again, Carrie.
Sorry, technology. Let's see if I can turn it up.
The second season comes out next week. Oh.
Carrie put a comment. Somebody may want to speak on that.
Okay. Any better or not really?
Go ahead, because I'm hearing you. It's a little bit quiet, but go ahead.
I was thinking just more of, you know, obviously we see a ton of child abuse. So just sort of helping to identify in maybe an algorithm form or similar to the Safe Sleep about EMS recognizing A, the risk factors, and B, sort of problem bruising sites. So there's a ton of stuff you are aware of, PACES and 10-4 bruising and all of that. But kind of just collecting that all in the same place with factors. And then I hear a lot from EMS, they're sort of a little bit in an uncomfortable spot of what to do if they identify those and parents are refusing transport, things like that. So I know everyone has their SOPs that they follow, but just if that would be helpful.
Okay. So more of an education on awareness and then processing advice.
Yes.
Okay. That would be good. To be honest with you, I've been the medical director of the center down here for 10 years. So I have a number of things that that I have done in the past, and I can bring it forward and we can work on and edit it. If it's a slide set, we can turn things into handouts. The education committee just got finished working on an algorithm that did outline child abuse related issues, and I can maybe Julia can send that out to everybody so we can see that what's already there.
Sure.
Okay. Okay. Thank you, Carrie.
Thank you.
Okay. Julia, if you'd be so kind, maybe just email everybody and prompt them to just kind of keep in mind for suggestions going forward in addition to the child abuse related topic. That'd be great.
Yeah, that sounds good. Thanks everybody for your feedback.
Okay. And I think we have a call to the public next. Agenda items for the next meeting. Anyone have any proposed agenda items for next meeting? Okay, none being said, call to the public. Comments from the group? Upcoming events. So Northern Arizona EMS is going to be doing their pediatric symposium in Flagstaff. It's a wonderful time of the year to visit that area of the country, particularly if you're coming from the desert. March 1st and 2nd. Having participated in this over the number of years, I highly endorse it. It's a great 2 days of education. The first day is almost entirely simulation training, and the second day is lectures, and you get a good breakfast and lunch out of it. Oh.
Dr. Woolridge, this is Tony. The committee has voted that this is going to be a virtual conference this year.
Oh, shoot, that's right. That's right. Sorry.
That's okay. We're trying to determine right now if we have the bandwidth to pre-record the scenarios for day one or day two. But with it being virtual, it is going to be a free conference. There definitely will be lectures, and we're trying to figure out that agenda and get that determined hopefully here, I think, in December. So that'll be reported out.
Thank you, Tony, for that clarification. Sorry, I reverted back to the way I wish it used to be or is. And then Julia, do you want to comment on the next one? News and conference page?
Sure. I mean, we will post different news and news and different conferences on our webpage. So if you check that occasionally, you'll be able to see any kind of upcoming events or educational opportunities.
Yeah. Great. All right, thank you for that. So our next meeting is going to be in March 18th, same time at 1:30 in the afternoon. And Julia will be sending out meeting information as that gets closer. Keep an eye out for Julia's email when she sends some of the materials that we spoke about. And again, brainstorm on projects going forward, please. Any good ideas that you have, we want to hear them. Any ideas, good or not?
Yes.
Well, without further ado, Julia, any other topics to comment, or should we close? Shelley?
I don't have anything else on my end. I think we're probably ready to adjourn.
Okay. I don't think we need to vote on this one, though, do we?
That's correct.
Thanks. You guys all have a wonderful afternoon and a great Thanksgiving next week. And be safe and be infectious conscious.
Thank you, Dr.
Thanks, everybody.
Thank you.
Everybody.
Wow.
Thank you.